This is the Ag Queen Podcast. This podcast explores the agriculture industry with the movers and shakers of those shaping it. Here's your host, Lori Boyer.
At the recent National Association of Farm Broadcasting Convention, I had a chance to visit with Mollie Van Lieu, Vice President of Nutrition and Health with the International Fresh Produce Association. I started off by asking her what exactly the International Fresh Produce Association does.
So we are a trade association representing the full fresh produce supply chain, so everyone from the seed growers all the way to the last point before the consumer takes it home, be that restaurants, schools, hospitals, or grocery. But the bulk of our members are the growers of fresh produce.
So are you a lobbying organization?
That is a component of our work. That's what I do along with colleagues. We have a robust government relations department, and we do lobby for the interest of the industry.
Okay. And so I know rules and regulations probably come into your world quite a bit. This is not on your list, but one of the things that has come up here over and over during our conference is workforce issues. And I know in the specialty crops, there's more robotics coming out, but we are still struggling with finding workers, right?
Absolutely. That's the number one issue that we hear from our industry. Obviously, the goal is to grow fresh produce consumption, and that's an area I specialize in through the nutrition space. But we have to make sure that when we achieve those goals, we have an adequate supply of fresh produce, which is very much dependent on a workforce. Here in the United States, we can import, and we are rapidly importing produce, but everybody wants to be able to buy American-grown produce, and we do need an adequate workforce to do that.
Absolutely. To your point, people want to know where their food comes from. They want to know where it's sourced from. So I think that you hit on that. But tell me a little bit more detail on the work you are doing. What are you looking for in some sort of federal workforce program?
So for federal workforce program, we want to see an H-2A program that's workable, but long-term we need more workers. So we depend on a vibrant workforce. We need to make sure that we continue to have access to those workers. To date, I think it's well established at this point that American workers are generally not willing to do this work, so we are dependent on folks coming across the border, so we need to be able to do that in a way that works for everyone, so safe options to access foreign workers.
And one more question on that we're calling it Trump 2.0 around here.
Yeah.
Any inclination on where that will head? Will we kind of start over, build on what's already going on? I mean, what are your inclinations as of right now and what that might look like?
Specific to labor?
Mm-hmm.
So, no mistake that the campaign message has been to enforce undocumented and individuals in this country. And the reality is that they do exist in this country, and they are, working in industries all across the country But we also know that the Trump administration is dedicated to the agriculture community, and so we will be working with them to ensure that they understand our reliance on agriculture workers, and to make sure that we have continue to have a reliable supply chain of fresh fruits and vegetables.
From the standpoint of IFPA and your work, what are some of the things that you think you'll be working on? What are some things that you think might be a little bit more challenging to work on with him?
So in the nutrition space, we're very much focused on how we can grow consumption of fruits and vegetables, and early reports and early messaging is that is something that they are focused on as well. The appointment or the nod yesterday to RFK Jr. being appointed to HHS is interesting, and we will use that as an opportunity to talk about the opportunities to grow fruit and vegetable consumption. There are a lot of questions with that appointment around what that could mean. There are areas where, quite frankly, I think he's gotten the science wrong, and we're an industry that science is always on our side. So we need to be very vigilant about that and make sure that there are no negative impacts to the produce industry in that work. So we'll definitely be focusing on opportunities to increase nutrient density in the food supply. But as we know, the Trump administration can humble you if you try to predict anything. We learned that the first time, and we're learning that again, I think the second time. If you asked me a day ago if he would have appointed RFK, I would have said no. We're going to take it one day at a time and see what comes and continue to just advocate for the best interest of the industry.
On this notion, Mollie, of food as medicine, what does that mean exactly?
So it means a lot of things to a lot of different people. How we view it is very much a food intervention. So a policy where you treat fruits and vegetables as a standard practice of clinical care, much like you would a pharmaceutical. So we're not trying to supplant pharmaceuticals, but if you go in and are diagnosed with diabetes, you can still get your insulin, but you would also get a fruit and vegetable benefit as a companion to that, because we know short and long-term impacts are better and outcomes for the patient if they're eating healthy, with the idea that it is financed by the healthcare industry, because that's where the ROI is, which is a lot different than how we've traditionally treated kind of food interventions in our country.
Yeah, that is interesting. So why do you think they are financing that, especially because we know the pharmaceutical companies tend to make a lot of money off of people who need care?
Yeah, so I think we're at this tipping point where you look and you see that 80% of healthcare costs are spent on preventable chronic diseases. It's not sustainable. There certainly are people who are making money off of it, but I think if you just look at GLP-1s, you see that's really changing the trajectory, and that's obviously long-term going to impact how people eat. Certainly the food industry is reacting to that. The early data suggests that fruit and vegetable consumption increases with GLP-1s, which is really positive for us. From our perspective, we pursue the healthcare route because it's really in anywhere else that the federal government has invested in dietary quality, the opportunity to scale that work is just not there. It's going to take it's a combination of political will, but also a financial contribution that realistically we don't necessarily see the federal government make. But if you can embed it into the healthcare system, where they already have a system that shows that if you can save money, even though we're spending like a ton of money on diabetes, treating diabetes is still less expensive than not treating diabetes long term, or at least treating it early on. So kind of putting that into the system where you get an ROI on an intervention is the direction that we're pursuing, and it's an uphill battle in some regards, but we're definitely seeing progress, and health insurers seeing the benefit of that as well.
Will there be enough fruits and vegetables to supply this kind of new notion of prescribing food, fresh food, for health reasons instead of a pill?
Yeah, so the fresh produce industry is, I'm biased, but is the most nimble, in my opinion, fresh produce or food industry out there. And I think we saw that during the pandemic when other things weren't on the shelf, fresh produce was. This is not something that will happen overnight. We would love it to. It can rapidly increase, but I think the fruit and vegetable industry will absolutely step up and be able to fulfill the demand.
And I know, being in Colorado, the Colorado fruit and vegetable growers, we've talked about this. I have done some interviews. They've brought in some experts. So it sounds like maybe organizations are preparing their growers.
Absolutely, yeah. So it's an interesting area because right now policy is kind of what needs to happen. So day to day for growers, there's not always a tangible way to get involved, except for advocacy, which we encourage growers to do and talk to their state policymakers and their federal policymakers as this being an opportunity to support American agriculture.
And I have another question on that. And this really may not be in your lane, but it kind of is in your lane, because there seems to me there would be a mental aspect to this, because We are used to going to the doctor, paying a large amount of money to see that doctor for 15 to 20 minutes, walking out with a prescription that we think is going to help. It might be frustrating to walk in there and walk out with the doctor telling you, eat more broccoli.
Exactly. Well, that's happening today, but especially for people who are low income that may have affordability issues, that's a hard conversation for both the patient and the healthcare provider. So that's where these interventions come in, because you're saying, hey, I'd really like you to eat more fruits and vegetables, and this is how I'm going to support you, and doing it with an actual stipend, essentially, to do that.
Okay.
Maybe a companion of having some of these programs have also referral to a dietitian. Now that is a lot to scale both of those things, and the data suggests that even if you just give the fruit and vegetable benefit, you see really good outcomes. But there are logistical things that we have to work on in that space, because as you shared, when you go in and talk to your doctor, like, if they can't bill for it, like, you're probably not having the conversation. So we're working on that now too, with our partners, of how do you get kind of a standardized billing code so you can have the conversation, and how do you bill the produce.
Thank you to my guest here today, Mollie Van Lieu, Vice President of Nutrition and Health with the International Fresh Produce Association, joining me from the recent National Association of Farm Broadcasting Convention in Kansas City, Missouri.
Thanks for tuning in to this edition of the Ag Queen Podcast with your host, Lori Boyer.